Ever wondered why waiting times in Canadian hospitals have been skyrocketing recently? Picture this. You're in a packed waiting room, anxiously looking at the clock as hours tick by. The staff are clearly overworked, their faces etched with exhaustion. The quality of patient care seems to be on a downward spiral. This, unfortunately, is the reality of Canada's healthcare sector staffing crisis. It's a complex issue, a puzzle with many pieces, and we're about to piece it together. Hold on tight as we unravel the 5 primary reasons behind this collapse. Starting with reason number 5, Canada's rapidly aging population. This demographic shift is increasingly applying pressure on the healthcare system. In the Great White North, more people are living longer lives, and this means more individuals requiring medical services and care. This demand is stretching the healthcare sector thin, as seen with the rise of senior home care companies like Care. Co-founders Tausif Riaz and Saba Tausif recognized this growing need for elderly care services and the strain it was placing on the system. They saw a need for innovation, for improved communication between caregivers and healthcare professionals. And yet, even with these advancements, the stress on the healthcare staffing sector continues to mount. As Canada's population continues to age, the pressure on healthcare staffing intensifies. Moving to reason number 4, the chronic lack of funding and resources. It's a common story across the globe, and Canada is no exception. The healthcare sector has been largely underfunded for years, leading to significant shortages in essential resources. Hospital beds and medical equipment, for instance, are in high demand but low supply. This scarcity is not just inconvenient, it's a serious threat to the well-being of patients and the sanity of our healthcare workers. Imagine a bustling hospital, filled to the brim with patients needing immediate care, but there just aren't enough beds to accommodate them. Or picture a situation where critical medical equipment is in short supply, forcing healthcare workers to make tough decisions about who gets what and when. It's a grim reality, and it's happening right here, right now. Budget cuts have only made the situation worse, leaving an already strained system struggling to keep up with the growing needs of the population. The result? Overworked healthcare staff, longer wait times for patients, and a healthcare system that's teetering on the brink. Without adequate funding and resources, the healthcare staff are left to bear the brunt. At number 3, we have an unexpected culprit: the COVID-19 pandemic. This global health crisis has left no nation untouched, and Canada's healthcare sector is no exception. With its arrival, hospital beds quickly became occupied by COVID-19 patients, leaving less room for others in need. The already strained healthcare staff had to adapt to a new reality, spending more time on infection control measures, further stretching their work hours and capacity. This pandemic has not just been a health crisis, but a crisis of resources as well. The increased demand for medical care meant that healthcare workers were in higher demand than ever. Yet, with the risks associated with the virus, this was a demand that was difficult to meet. The COVID-19 pandemic has thrown into sharp relief the vulnerabilities of Canada's healthcare sector. It has shown us how a sudden increase in patient numbers can quickly overwhelm a system already struggling with staffing issues. The pandemic has stretched the already thin healthcare staffing to its breaking point. Reason number 2 might surprise you: the lack of empathy and quality of care. Imagine, if you will, Tausif, one of the co-founders of Care. He experiences a serious illness and is admitted to a hospital during the peak of the COVID-19 pandemic. The scene he encounters is far from comforting. The lack of empathy and quality of care for the elderly patients, including himself, is glaringly obvious. This isn't an isolated incident, but a reflection of a systemic issue. This lack of empathy and care quality isn't just detrimental to patients, but also to the staff. Healthcare professionals find themselves in a discouraging work environment where they can't provide the level of care they aspire to. This becomes a vicious cycle as the quality of care continues to decline. When empathy and quality are lacking, the staff morale plummets. And finally, the number 1 reason: a severe staffing deficit. The healthcare sector in Canada is grappling with a significant shortage of staff. This crisis isn't isolated, it's deeply connected to the other challenges we've discussed. The aging population places a heavier burden on the healthcare system, demanding more hands on deck. However, the lack of adequate funding and resources makes it difficult to hire and retain the needed workforce. The COVID-19 pandemic only worsened the situation, stretching the already limited staff to their breaking point. Moreover, the lack of empathy and quality care in the system has left many healthcare professionals disillusioned, further contributing to the staffing deficit. It's a vicious cycle, The more the staffing deficit grows, the more strain is placed on existing staff, leading to burnout and exacerbating the deficit further. The staffing deficit, the culmination of all these factors, is the final nail in the coffin. Another crucial factor in this crisis is the brain drain in the health sector. The healthcare system in Canada, already under strain from the issues we've discussed, is also grappling with a significant loss of skilled professionals to other countries. The lack of adequate funding, resources, and quality care makes it difficult to keep these valuable members in the workforce. This brain drain, as it's often called, further exacerbates the staffing deficit and the overall healthcare crisis. The brain drain, a significant contributor to the staffing crisis, needs immediate attention. It's another piece of the puzzle that can't be overlooked. Moving on to Scene 7, the staffing deficit. What implications does this have for Canada's healthcare sector? We've examined the mature population, the scarcity of funds and resources, the repercussions of the COVID-19 pandemic, the lack of humaneness and superior care, and now the impending staffing shortage. All of these elements weave escalating into a crisis that calls for prompt intervention. Tackling these concerns is crucial for the prosperity of Canada's healthcare sector. The action must be taken without delay. Please press the like button and subscribe to this channel if you have enjoyed this video.